Today, to promote Breast Cancer Awareness Month, Local 10 officially kicks off an initiative that we're calling Mammogram Monday.
We're all in pink. Every Monday in October, we'll be bringing you inspiring and informative stories aimed at helping you take measures to prevent this disease. We begin with our health specialist, Kristi Krueger, debunking the myths surrounding breast cancer screenings.
When it comes to mammograms, it's often difficult to tell what's fact and what's fiction. Do you know when a person is supposed to have their first mammogram?
Well, according to what they said, it's about, for me, 40 years old.
I don't know when is the first year. I do it every year.
Mammogram images have long been the gold standard when it comes to the diagnosis of breast cancer. And since 1 out of 8 of us will hear that diagnosis in our lifetime, it's vital that we know the truth about mammography. Dr. Mary Hayes, Chief of Women's Imaging at Memorial Healthcare System, breaks it down. Myth number 1.
The first one is I don't want to get a mammogram because it hurts or it takes too long.
The fact.
Mammography is breast compression, typically 4 pictures of the breast. Each picture takes about 2 to 4 seconds.
It can be uncomfortable for a few seconds, but not really painful.
Okay, now stay very still, don't move.
Lisa Harper is a breast cancer survivor and now a volunteer coordinator at the hospital, making it her mission to encourage women to be proactive about their health. She says a routine mammogram saved her life.
I knew that it was early. I knew that I had annual exams, and I knew the size of the tumor was small. So I was confident that I could beat it, but it was only because I think I went for my annual mammogram.
Another myth, that you're more likely to develop breast cancer if you have a family history of the disease.
It's important to know that about 85% of women who do get diagnosed with breast cancer do not know about any family risk that they have.
And yet another myth, radiation from a mammogram can cause breast cancer to spread.
So the radiation dose that a woman gets from a mammogram is similar to maybe a dental x-ray. It's actually less radiation than a woman would get to her breast. She would get more radiation flying cross-country in an airplane.
So at what age should women have their first mammogram? There's a lot of controversy about that one.
We should look at a woman's risk of getting breast cancer for each decade of life. So a woman in her 40s is at risk for getting breast cancer, and we should always start screening women at age 40.
That's the age Lisa began having her annual screenings. In fact, 1 in 6 breast cancers occur in women under the age of 50.
When we can catch a stage 1 breast cancer very early, women have a greater than 98.5% survival, and that's where I like our patients, in their survival mode.
With your Mammogram Monday report, I'm Kristi Krueger, Local 10 News.
And Dr. Hayes says keeping a healthy lifestyle helps to reduce the likelihood of breast cancer. For more information on breast cancer resources, survival stories, and our Mammogram Monday initiative, check out our breast cancer awareness page on local10.com.